Hi, I'm Nick Turnbull. I'm a specialist orthodontist, and in this short video I'm going to go through a few handy techniques and helpful hints about how to deal with potential problems or breakages of fixed appliances or train tracks. And this might be especially useful for patients who may not be able to see their orthodontist for a longer period of time. So this is a model of an orthodontic appliance with a fixed brace in place. As you can see, it's made up of a number of different parts. The main part are the little squares, and these are made of stainless steel, and these are attached or glued to each individual tooth. Between them, there is a piece of wire that runs between all the way from the back around to the other side, and this is connected to the squares by little elastic rings, and these are the colours that often people will choose. In this case, there's some blue and pink. Each ring is attached around 4 corners of the bracket. One of the common problems that orthodontic patients have is loss of one of the coloured rings. In this case, there's one lost from this canine tooth here. And what can happen is the wire can come a little bit loose, as I demonstrate here, so that it comes away from the bracket. This could allow the tooth to move a little bit, but in practice, very small amounts of movement generally occur, and it's not really an emergency as such, and can wait until the next available time to come in and see the orthodontist, which is a very quick procedure just to put a new little elastic ring back in place. One of the things that you can do if the wire does move and come loose like this is you could try and push the wire back into the slot. And a handy way of doing this is to use a pencil with a rubber on the end, as this gives good grip of the wire, and again just pushing gently in to push it back into its slot like this. Another example where the pencil is useful is where the wire bends between the teeth upwards. In this case, the wire is nice and straight and it's bent up, possibly by chewing on something very hard or something that shouldn't really be there. It bends up out of the way, and again, it's not a major problem, but it can put a little bit more pressure on the teeth, which could then become a little bit painful. So again, if you use the rubber end of the pencil, usually it's possible to get round to the back, or it might be at the front, and push the wire back down into place with a bit of gentle pressure like this until the wire is flat again. And that could be used on a bendy wire at the front. With orthodontics in general, the wires at the start of the treatment are quite flexible and are quite easy to move like this. As you get through the treatment later, the wires become much stronger and a different material, so they're much stiffer, and it's not always possible to move them, but they're less likely to be damaged as well. Okay, so another common orthodontic problem is where a flexible wire comes out of the slot at the back of the mouth like this, so you tend to have can be quite a long piece here that's movable during eating or talking and so on, and the end may catch in towards the cheek, or it may bend upwards towards the gum, causing problems or trauma. So there's 2 options with this. One quite good thing sometimes is to just use your finger, or again the pencil, and to just try to push the wire to rest underneath the little hook on the tube at the back here, and sometimes that's possible, and we'll give the wire somewhere to sit like this, so it's tucked out of the way. If it stays like this, it's less likely to bend out towards the cheek and cause any cuts or problems that way. It doesn't always stay like that. And the other option then would be potentially to try and push the wire back into the slot. And on these tubes, they have a slot that runs down inside here, and the wire just sits passively in there. It's not connected by any of the elastics like here. It just sits inside it. Now, it is quite difficult and far back in the mouth, and you would definitely need some sort of tweezers to be able to manipulate the wire back in. Very bendy wires, many patients or parents do this, others struggle with it. So there is one slightly more final option that you can do with this, that is to cut the wire. And again, it's quite far back in the mouth, so it can be a bit tricky. But the best way of cutting these wires is to use a nail clipper, which most people will have in the house. If proper wire cutters are available, then you could try them. But a nail clipper like this one here can be quite useful, and you could try and cut the wire close to the back here, like this. So it's fairly near to the long piece, and trim there. If you're struggling to get far back in the mouth, it's reasonable to cut it a little bit further forward here, so that it's even more wire is cut. So you could cut it here, and then you just pull a longer section out in the clipper, and obviously throw that away. And that's quite a useful trick. until such a time as you can come and see the orthodontist when we would replace the wire. Another common orthodontic problem is the fixed appliance rubbing against the inside of the cheek or the lips. And one thing that's useful for this is to use the dental wax that most patients are given in order to cover the individual bracket. This might be especially useful if an O-ring has been lost, as the edges can become a little bit more prominent and a little bit more rough against the lip. The wax is just a simple edible white wax, and the best way of doing it is to dry off the area on the tooth that has the problem as best you can. A good way of doing it is either with some tissue or a cotton bud, and to try to get the area as dry as possible. And in that way, the wax is much more likely to stick for a longer period and be more effective. The wax is taken off a little stick like this, and take a pea-size amount and just roll it into a small ball to make it a little bit more sticky between the fingers, and then find the offending area and just press over and try and work it into the edges and around and under the wire, so it forms a soft cover like this. It will come off, and it's okay if it's swallowed. Any foods and liquids high temperature may come off a little bit quicker, and it can be peeled off if it's still on just by fingers, and then give the teeth a good brush. It does help on any of these areas. It's especially used for sharp bits of wire. At the back of the mouth here, you can see at the very end there's a very small end of wire that's poking through, and the bit that's poking through doesn't have to be very big at all for it to cause some irritation. What does happen, however, is the back of the mouth around the gum and the cheek lid does tend to harden up a little bit over time, and patients get less and less troubled by this. But again, this can be clipped, but it's extremely difficult to clip very small amounts. And as I said previously, you could clip it a little bit further forward on the wire and then pull that section of wire out, and that would immediately remove the problem. But again, the other option is to use a piece of wax, again, small pea size. Try and dry the area as best you can at the back, a little bit more difficult, and put a piece right over the back, pressed over the block or tube there and the wire, and that again will give some temporary relief. Another potential problem with fixed orthodontic appliances is that the brackets or squares here come away from the tooth. The glue fails and it's debonded so that the whole bracket can become quite loose. It's still attached to the wire, as in this case, by the pink ring of elastic, but it is quite movable if the wire is bendy. If the wire is a very strong wire later in the treatment, it can actually be quite solid still, and patients sometimes don't realise they've come off. They tend to come off usually due to eating very hard foods, or possibly habits such as chewing fingernails or chewing pencils at school. When it comes away like this, it's quite easy to move the actual bracket backwards and forwards along the wire, and often patients will find it loose by just this movement. It can also go up and down quite easily on these thinner wires. It's not really an emergency, and it can be a little bit irritating to the patient that it moves, possibly during chewing, but that's probably the worst thing. The tooth in question that it was bonded to can sometimes move a little bit in the wrong direction, but that's usually quite rare and very small amounts. And if you can come in to see the orthodontist reasonably soon, it can be glued back on quite simply and replaced. If there's a delay in coming to see the orthodontist and the bracket is moving around a lot or rubbing or causing problems, it is possible to remove the whole bracket from the wire, and that involves taking off the little ring. Now, I would normally use something like this, a probe which just goes inside the edge of the elastic, and I would pull it off each of the four corners. What you could use at home is something like a cocktail stick like this, and it is a little bit tricky, but the idea is to try and just get underneath the edge of the pink ring like this, and you may need to use a finger just to steady the bracket and just pull the elastic away and upwards away from the four edges of the bracket. And again, it may move around a little bit, and then take the elastic out and dispose of it. The bracket then may just fall away from the wire and it can be spat out, or it may need just to push gently, especially with a bendy wire, away and removed like this. If you do take out the bracket like this, don't bother trying to keep it, because if we see you again, we would always replace it with a new one. The wire will then be sitting on its own across this area. It could then bend a little bit more, obviously, during chewing and so on, but you could use a pencil with a rubber on the end to push it back into line, or even clip the wire here if you needed to and remove that section of wire. A more extreme example of self-home maintenance would be to remove the whole wire, and this could be, for example, if the wire was particularly long at the back and couldn't be clipped, or a number of the brackets had been lost and the wire kept moving around. And it is possible, especially with thinner wires, to remove the entire wire from the mouth by pulling the whole wire forwards, so it comes out of the slots here and here. But what you would need to do is try to remove as many of the little rings as possible. And again, using a cocktail stick, just pushed in between the elastic and then move it from side to side and up and down. It comes off quite easily. And it's much easier to do this with the bracket when it's still attached to the tooth, like this. And if you can take off most of them, especially at the front, it then may be possible with a pair of tweezers or even the fingers just to hold onto the wire here and just pull forwards gently, and it should come out of both sides, and then you can dispose of the wire. That will immediately get rid of a problem such as a long traumatic piece of wire or a piece that's snapped here that's digging into the cheek. Thank you for watching, and I presume if you are watching this video you do have a broken brace, and I really hope you found it useful.